Welcome back. Okay, so we are continuing. This time around, we are looking at physiotherapy in oncology. We're trying to see the role of physiotherapists in oncology. What do physiotherapists do? So, oncology is the branch of medicine that specializes in the diagnosis and treatment of cancer. It includes medical oncology, which is the use of chemotherapy, immunotherapy, hormone therapy, and other drugs to treat cancer. Also, radiation oncology, which is the use of radiation therapy to treat cancer, as well as surgical oncology, which is the use of surgery and other procedures to treat cancer. Cancer is the second leading cause of death globally, responsible for an estimated 9.6 million deaths as of 2018. Globally, about one in every six deaths is due to cancer, and approximately 70% of deaths from cancer occur in low and middle income countries, which is where we are. Hence, the reason why we have to put concerted efforts in managing it. Around the third of deaths from cancer are due to Around one third of deaths from cancer are due to the five leading behavioral and dietary risks, which is number one, high body mass index, okay, which is a combination of behavioral and dietary outcome. High body mass index to lead to obesity, low fruit and vegetable intake, lack of physical activity, tobacco use, and alcohol use. Physiotherapist is involved. Physiotherapy is involved in care, management, and rehabilitation of cancer patients from diagnosis to the end of life. They conduct an ongoing assessment of the needs of this patient group and their carers in order to apply skilled interventions which are vital for patients which are vital for the patient's independence, functional capacity, and quality of life. So physiotherapists will be there to apply these skills so that you guarantee the patient of their functional independence, and as well as the quality of life. So physiotherapists are part of the multidisciplinary team, which is the key to successful rehabilitation and management of the patient in cancer, the patients with cancer, as well as palliative care at the end of the day as end life stage care. The absence of physiotherapy intervention would be detrimental to patient care and the ability of the family and the patient to cope with the effects of the disease or its treatment in their functional capacity and quality of life. So, oncology being a branch of medicine that involves the prevention, diagnosis, treatment, and the study of cancer, Cancer describes cancer is described as the abnormal growth. Is described as the abnormal growth of cells that result in a large mass known as a tumor. So this tumor can be malignant or benign. A malignant one is the one that can spread into and invade surrounding tissues and in some cases, the cells that can break off and travel to other areas of the body, which is known as metastasis. So the malignant one has the capacity to spread into the surrounding tissues and spread into the surrounding tissues, affect the other cells, and in some cases, those cells can even break off and spread to other distant places, which is known as metastasis. Benign tumors do not invade surrounding tissues and do not continue to grow once they have been removed. The regression of cells is controlled by genetics and takes it takes the genes to create abnormal cancerous cells. So these genetic changes can be due to either loss or gain of chromosomes through the process of mitosis, which is the process of cell division, or it can be due to mitosis, mutations in which a cell can be subjected to some stuff or some exposures which it is not initially meant to endure. At the end of the day, it will adapt, change to conform to the amount of stress you are giving it, ending up mutating the genes so that it keeps on producing the type of cells that are equal to the stress that we're giving them, which will end up being the wrong type of cells in that tissue and become cancerous at the end of the day. There are several causes of cancer. The most common being genetic mutations due to environmental and the lifestyle factor, which accounts for about 90 to 95% of cases. The remaining are due to inherited genetics, which just accounts for about 5 to 10%. There are many non-environmental factors that increase the risk of developing cancer, and amongst them are carcinogens. The most known carcinogen to cause cancer are those that come from tobacco. Okay? Tobacco, with tobacco smoking each year, tobacco is responsible for more than 7 million deaths worldwide, and more than 6 million of those can be attributed to direct tobacco use. But there are approximately about 890,000 that are as a result of second-hand smoking of tobacco. So it is actually a twofold thing. Both secondary and primary smoking of tobacco is problematic. Okay. Radiation is also among those that are known to be causing cancer. Some time back, we knew or it was known that only large amounts of radiation can cause cancer, but this time around, new science has it that even low dose of radiation emitted from X-ray machine can put a person at risk of developing cancer, especially if exposure starts at a younger age and keeps on repeating more often. Pollution is one of those that can cause that predispose one to developing cancer, in which air pollution has been identified as contributing risk factor for developing cancer and also for lowering the rates of positive prognosis. So just as I explained, because of the stress that that the airway or whichever structure is more exposed to these pollutants is, due to that overexposure, the cells of that structure, we want to conform to the amount of stress that it is being subjected to, and that conformation is the one now which is going to mutate the gene so that it produces the cells that are equal to the stress that you are giving it, and those cells will be cancerous, and it brings about cancers. So pollution is one of the causative agents on the list, or it is the one of the predisposing factors on the list. Also, diet, exercise, and obesity are also on the list of the predisposing factors, in which obesity has been recognized as a contributing factor in relation to cancer, both in terms of risk and mortality. Therefore, controlling obesity, diet, and exercise also have a role to play in preventing and managing cancer. The World Health Organization estimated about 20% to 40% decrease in the risk of developing breast cancer among its physically active women. So this is something that can also be researched in our setting. This was in whichever setting that it was, where this research was done. But you can also do this in our setting and try to validate or try to see these responses in our setting. If what they found is what we can also find in our people here. You know, we are exposed to different environments. Okay, others live in areas which receive less sunshine. Here we have a lot of sunshine and a lot of other environmental factors in different places. So this can be checked, and you see if a physical activity responds in a similar way to those environments, then you give us the results. And in another study published in 2008, a group of 2,987 women participated in a study via questionnaire that showed physical activity was associated with an improved prognosis. As much as physical activity can have a positive effect on preventing and improving prognosis, lack of physical activity can be detrimental. So it is very important that a person with cancer is physically active, as it also boosts the immunity according to the findings of the studies that have been done. Infections is also one of them. It has long been recognized that infection are a cause of cancer, and in 2002, it was estimated that approximately 18% of malignant cancers could be attributed to infection. So it is important to minimize infections. Otherwise, repeated bouts of infection can make the cells become cancerous, and it is attributed to be one of them. Stress, it is evidence that stress has a detrimental effect on the immune response and may be a contributing factor to initiation and, in some cases, progression of cancer, as it reduces or lowers the immune system. So the body has little ability to save itself from the effects of the cancerous cells. So stress is something that is supposed to be managed or avoided. If we cannot prevent it, at least it should be managed at all costs. There are many types of cancers that exist. Amongst them, the common ones being breast cancers, cervical cancers, in all this list. So physiotherapy has a role to play in here. Physiotherapists are ideally situated to provide secondary preventive interventions in the treatment using prospective surveillance to those surviving cancer. Prospective surveillance model of care include preoperative examination. Preoperative examination, when you're getting the baseline of your patient before you do anything, before they go into operation and back. You check for the range of motion of the limbs, especially the affected limbs or those that will be affected after the surgery, strength, you have the baseline strength, the limb volume, anthrometric measures, which will include the body mass index, functional status, and the level of physical activity. So have all these as baseline measures pre-operatively. Education for post-operative plan of care and how to monitor for signs and symptoms for early adverse effects of treatment such as pain, joint mobility, and weakness is also very important. Therefore, the management of cancer is a multifaceted kind of arrangement. It has a multifaceted approach in which you aim to improve the physical and functional well-being of the patient throughout the cancer journey. And this approach should include pre-rehabilitation care, rehabilitation care, and survivorship. So physiotherapists assess baseline fitness and provide education as well as enhance physical fitness, psychological well-being to mitigate treatment side effects. Okay, so that is what we do in pre-rehabilitation. We make sure that the patient, we have the baseline of the patient so that we also educate them. And this education comes with the patient themselves as well as everyone around the patient. They should understand the condition and know exactly how to help the patient. In rehabilitation, during active cancer treatment, physiotherapy focuses on maximizing functional ability and managing side effects such as fatigue, pain, and lymphedema. Exercise intensity is typically lower during this phase. Okay, then survivorship. After treatment, physiotherapy targets optimizing physical fitness, managing long-term effects of cancer and its treatment, and helping patients return to normal activities and work. Physiotherapy interventions include exercise therapy so that to improve fatigue, muscle length, and cardiovascular fitness, manual therapy, which includes techniques such as massage, lymphatic drainage, to manage lymphedema and pain. Then you are also supposed to give education and support, educate the people on managing the patients on managing symptoms and improving the quality of life. As I earlier put it, this should be targeted to the patient and the people, the caregivers around the patient so that you improve the quality of life of this patient. This is where we end our discussion. Thank you for your attention.